Hi everyone, welcome back to Farm Josie's channel. So how is the August rain going? Hope you're all enjoying it. Okay, so in today's video, we'll be talking about the side effects and the dangers of self-medication. Now, for some diverse reasons, self-medication has become rampant in the society. It has become a trend. A lot of people no longer go to the hospitals to have themselves checked. A lot of people do not go to the pharmacy stores to purchase over-the-counter drugs. They just take what is available that will relieve them of their pain. And once they are okay, they forget about the conditions. Now, what is self-medication? Self-medication is taking drugs without the doctor's prescription. You will have to learn how to trust your pharmacist. You have to learn how to trust your doctors. You have to learn how to trust your medical professionals to be able to provide them with the adequate history of your illness, as well as the underlying conditions for which you might be taking a particular drug. Now, why do people self-medicate? Number one is ignorance. A lot of people are ignorant about their health. They don't care about themselves. They just take what is available that will relieve them. And then they go away forgetting the condition. Number two is lack of time. People these days get so busy that they ignore a lot of things happening to them. There are some days you wake up feeling so weak, feeling so tired, and instead of going to the hospitals to have yourself checked, you keep procrastinating. You tell yourself, I'll go tomorrow. When tomorrow comes, you say, I'll go tomorrow. They don't have time. You need to create time for yourselves. Go to the hospitals and have yourself checked. Health is wealth. Number three is lack of health services. Now, there are actually some rural areas that do not have hospitals, they do not have pharmacy stores, they do not have clinics. So they decide to take what is available that will relieve them of their pain. Number four is extensive advertisement and availability of drugs. Now, especially in Abuja, in these Aerofy buses, you see a lot of people advertising drugs, advertising cough syrups, cough lozenges, antiemetics. Now, antiemetics are actually drugs that helps to deworm. Now, let's say, okay, there's a pregnant woman in that bus, and then someone is advertising albendazole, telling you, okay, it will help you to deworm, it will help to deworm your child and all of that. And you being the pregnant woman, you decided to get albendazole. Now, what you don't know is these people are not pharmacists. They are not medical professionals. So they will not tell you the contraindications of these drugs. They will not tell you what will happen to you when you take them. Albendazole is contraindicated in pregnant women. But because you're in a vehicle and you feel, okay, it will save me the time of going to the pharmacy, you decide to get albendazole. Then another reason is financial constraint. People feel going to the hospital will waste my time, it will cost me much. So they decide to just take what is available. These are the reasons people self-medicate. Now, what are the sources of self-medication? We have families, friends, neighbors, pharmacies, previous prescribed drugs. These are the sources. These are people that make us to self-medicate. Now, there are actually some disorders that will increase self-medication, that will make you to self-medicate. Now, depression, we have bipolar. Depression is actually a mood kind of disorder with a feeling of sadness or a feeling of sadness, feeling of anger. Then bipolar is actually a severe psychiatric or psychological disorder. Then we have ADHD. ADHD is attention deficit hyperactivity disorder. That one makes a child not to be able to concentrate. Then we have anxiety and stress. We have trauma. These conditions actually needs medical advice. When you have these conditions, you should seek medical and attention. When you self-medicate, what it does is it will only increase the severity of the symptoms. So seek medical advice when you have these conditions. Now, what are the dangers of self-medications? Number one, we have drug interactions. Now, drug interactions will actually, let's say for example, you are taking a particular drug and then you decided to self-medicate with another drug. It will influence the effect of the other one you are taking. So drug interaction is one of the side effects or the dangers, one of the dangers of self-medication. Then number two is misdiagnosis or incorrect self-diagnosis. Let's say, okay, for example, you have malaria. Someone else that had typhoid fever had the same symptoms. Now, malaria and typhoid fever have the same symptoms. Trust me. Some of these conditions have the same symptoms. So you have malaria, someone else that had typhoid fever, because you told the person that okay, you are feeling this way, and the person advised you to take a particular drug because he or she took that drug that helped her to treat the typhoid fever, and then you will go ahead to take these drugs for the malaria you're having. What I would do is it will suppress the symptoms. It will not treat the underlying conditions. That's one thing you should know. Those drugs will only suppress the symptoms. It won't treat the condition. You might decide to take the typhoid fever drugs, but it will not treat the condition. It won't treat the malaria. So that is why it is important for you to go to the hospital so that they can diagnose you and know exactly what is wrong, so you can treat the particular condition. The number three is increased risk of drug abuse and addiction. Now, when you decide to take a particular drug for some reasons, let's say, okay, you had a previous condition, you took that particular drug and it helped. Now, it will make you depend on that drug. You'll be addicted to those drugs and then you turn out to abuse them. So addiction and abuse is one of the dangers of self-medication. Another thing is increased risk in pregnancy and breastfeeding mothers. Now, there are actually drugs that are contraindicated in pregnant women. There are drugs that pregnant women are not supposed to take. Breastfeeding mothers are not supposed to take. So self-medicating will actually increase the risk in pregnant women and in breastfeeding mothers. And then it will lead to potential drug adverse reactions. That's it will make you have harmful drug reactions or some drug allergies or some allergies due to drugs that you take. So potential drug adverse reaction is one of the dangers of self-medications. Now, these drugs are actually important. It is important for you to seek medical advice. Go to the hospital, have yourself checked so that we can serve you better. Now, my job is to sort out, to identify the drug interactions. That is why it is important for the pharmacy to guide, for the pharmacist to guide you. That is why I'm here to guide you, to teach you the right way to take these drugs. If you have any condition at all, as small as it may be, go to the hospitals, have yourself checked so that we can know exactly what the problem is. Stay safe, guys. Health is wealth. So if you like this video, subscribe to my channel, make a comment, and then go to the notification box, turn on your notifications so that when I upload another video, you'll be the first to know. Take care, guys. Bye bye.